A combination of failures by government has left the Lenasia South District Hospital without electricity and water for weeks now. While other public hospitals are exempted from rolling blackouts, that hasn't been the case for the Lens Hospital. It's been grossly neglected, with doctors sometimes having to attend to patients in the dark. Sources at the hospital say there's sometimes no water to clean blood in the emergency room. For more on this story, we're joined by Bhekisisa health reporter Jessie Copelyn. Jessie, good morning and thank you very much for your time. You know, when reading your article, it honestly reads like a chapter out of a horror story. Just paint us a picture of the extent of the dysfunction that patients and staff have to contend with.
Yeah, thanks for having me. The doctors working at the hospital, as you say, didn't have any electricity for large portions of November. There were a series of reasons for this. One of them was that the substation in the area of Lenasia South experienced a fire early on in the month, and there were various problems with that substation throughout the month, even after that was fixed. The second big problem, of course, was that there was load shedding, and as you say, there are certain hospitals that are exempt from load shedding, and Lenasia South District Hospital isn't one of them. Early on in the month, the hospital was able to use its generators to fuel the hospital, but as time went on, as the month went on, they ran out of diesel for these generators. And so when load shedding happened, that meant, or when a power outage happened, that meant that the hospital just didn't have any electricity. The result is that, say, during stage 4 load shedding, this hospital would experience, up to 7.5 hours of electricity outages. What that's like for doctors is, doctors, for instance, who spoke to me who work in the emergency room, were treating patients who were coming into the hospitals with serious injuries, needed immediate treatment, like right there and then, or they would die. But they didn't have any of the electrical equipment that they would ordinarily have in order to treat these patients. So they didn't have monitors, for instance, that would check the patient's vital signs, like their heartbeat or their oxygen levels. They didn't have ventilators, which help patients who can't breathe. So the doctors had to come up with all sorts of manual techniques in order to assist these patients.
My goodness, this is honestly disturbing. We understand that even with the ventilators, they have battery life only for half an hour after the power goes out.
Yeah, that's correct. I mean, the doctors who spoke to me said that it was roughly about 30 minutes, and then after that, there is no ventilator. So they would have to use manual techniques. They have to use something called bag mask ventilation, in which they just use a bag filled with air to try and assist these patients. But of course, all of these techniques are going to be inferior to the electrical equipment that we have, and they're also going to be they're going to take longer to use. They're going to require more hands, and it's already a short-staffed hospital, so the lines get longer outside.
So what has management said about this? Because it's not just the electricity, there's also a water crisis.
Yeah, that's correct. I mean, so I think the people who we really need to ask about why this is happening are the Gauteng Department of Health, and the reason we need to ask them is because, we know that it was sort of load shedding and the substation problems that affected electricity at the hospital, but we'd expect at the very least that the generators would have diesel. And the fact that and we need to ask the Gauteng Department of Health why those generators didn't have diesel. According to sources within the hospital, the provincial health department just didn't pay the service providers who they've contracted to supply the hospital with diesel. And the result is they just didn't get their diesel deliveries. Yeah, so whether or not that is true remains to be seen, but that's definitely the question that needs to be asked.
And how is the community that is serviced by this hospital? How are they feeling about the state of the hospital currently?
Well, of course, the community of Lenasia South has faced all sorts of problems just outside the hospital as well. They've faced electricity problems associated with the substation and ordinary load shedding. They've also faced, regular water outages themselves. So that, that community for the last couple of years has experienced, regular water outages, which they, many members of the community need to plan their whole lives around when these water outages are going to happen. The hospital is ordinarily protected from this with their water tanks. But for at least the last week of November, they weren't able to they weren't able to provide regular water to doctors and patients. And as you say, the result is that they were not able to clean equipment. They were not able to just provide patients with drinking water. They were not able to flush toilets. Yeah.
It's honestly disturbing because hygiene is very crucial in a hospital environment because there can be so many infections because these are people with compromised immune systems. How is morale among the staff themselves? Because it must be very difficult. If you are somebody that is committed to save lives, but you watch people dying around you and you're so helpless, it must honestly be psychologically difficult to take this.
Absolutely. I mean, the doctors that I've spoken to are exhausted. And many of them are feeling depressed. I mean, one doctor spoke to me saying it's just actually difficult to go to work in the morning, and there is a depressed feeling amongst that doctor and among their colleagues, and absolutely that's going to be affecting their ability to to work every day.
No, we'll most certainly pose these questions to the Gauteng Health Department because we cannot have communities that seem to have been forgotten. We need to establish what exactly happened insofar as the diesel is concerned, the water is concerned, and just perhaps getting adequate staff to assist these doctors and nurses. But thank you very much for that particular article that shines the spotlight on the situation at Lens Hospital. That was Bhekisisa Health reporter Jessie Copelyn.